This is a short note on pudendal nerve and its applied anatomy. Okay, hardly it will take around 10 minutes to write this short note. Okay, so write a short note on pudendal nerve and its applied importance. Now the short note is important because the pudendal nerve is important during the surgical removal of the piles, okay, and during the difficult childbirth or during the to subside the labor pain, okay, labor pain. Now the answer is very short here. In the answer you may start write as introductory remark of this short note that pudendal nerve takes origin from S2 to S4 ventral rami, okay, of the spinal cord, sacral 2 to sacral 4. This is the chief nerve of the perineum and supplies to not only perineum but also to the external genitalia. So this is the nerve for sensory and motor to the perineal region and also supply to the external genitalia both in male and female. In male it will have the sensory supply to the penis and the glans penis, that is the body of the penis, and to the glans penis. Similarly it will also have the sensory supply to the clitoris in female. Now this nerve throughout its course is accompanied by the internal pudendal artery and vein. Now after its formation it leaves the pelvis through the greater sciatic foramina. Let us see this diagram first, okay. This yellowish thing is nothing but the hip bone as shown here. This is the greater sciatic notch. This is the ischial spine, okay, and this is the lesser sciatic notch, which with the help of this ligament called as the sacrotuberous ligament extending from the sacrum right up to the ischial tuberosity. This is the sacrotuberous ligament and it converts the greater sciatic notch into the greater sciatic foramina and lesser sciatic notch into the lesser sciatic foramina. Along with this and another small triangular ligament extending from the tip of the ischial spine towards the sacrum. This ligament is called as the sacrospinous ligament, while the previous one, this ligament is called as sacrotuberous because to the ischial tuberosity, this is the ischial tuberosity, it is going. Thus these two ligaments and these two notches are converted into the greater sciatic foramina and lesser. The piriformis muscle will go through this and just below the piriformis muscle, this is the formation of the pudendal nerve, which is formed by the S2, S3 and S4 rootlets, ventral root. So this nerve is the pudendal nerve in the greater sciatic foramina here. Okay, so this is pudendal nerve in the, so that then it lies on the posterior surface after its formation and coming out from the lower border of the piriformis. This now lies on the posterior surface. We are seeing this surface from the pelvic cavity and the perineum, okay, side medial aspect. Okay, this lies on the posterior surface of the ischial spine as it is coming from greater sciatic foramina to that towards that of the lesser sciatic foramina. Now after coming to the lesser sciatic foramina, okay, it then runs in the pudendal canal. So from greater sciatic foramina, it comes to the, it goes into the gluteal region where it lies posterior to the ischial spine. Once again it comes to the pelvis through the lesser sciatic foramina, and as soon as it comes here into the pelvis, this just passes into the pudendal canal, and pudendal canal is a facial canal which lies on the lateral surface, the medial surface of this is, we have already seen this muscle, that was the obturator internus, okay, and just above the ischial tuberosity. Obturator internus, where splitting of the obturator fascia or between the fascia obturator and the fascia lunata, this canal is formed. So this is a fascial tunnel in the lateral wall of the ischiorectal fossa. So this is the pudendal canal. So it runs then in the pudendal canal, okay. And now this pudendal canal is, as I said, present in the lateral wall of the ischiorectal fossa. This is the site for the ischiorectal fossa here. Now then it, as soon as it enters into the pudendal canal here from the lesser sciatic foramina, this gives a branch here, and this is called as inferior rectal nerve. Inferior rectal nerve. Now the nerve, that is the pudendal nerve in the canal, which is also called as Alcock's canal, is more superficial, I mean say superior to the two more structure, that is internal pudendal artery and the internal pudendal vein. It is superior. So artery and vein, they lie just below it, and all three structure, they pass through this pudendal canal. So as soon as it comes into the pudendal canal, it gives a branch that is called as inferior rectal nerve. And then the remaining part after this branch here of the internal, this pudendal nerve will divide into two. Again it will, this will divide into the perineal nerve. So I will just write here the perineal nerve. So there is no space below, so I am taking it up. This is the perineal nerve. Okay, so this one, this is the perineal nerve, the first branch. And this branch given here is the dorsal nerve of penis. See this long nerve going here onto the penis. Okay, so this is called as dorsal nerve of penis. So how many branches are given ultimately? Terminal from the internal pudendal, dorsal nerve of penis, and the perineal nerve. If you will trace further this perineal nerve in pudendal canal, then it will divide into for two terminal branches from the perineal one. One is called as the dorsal or posterior scrotal nerve. This nerve. See this branch. This is the posterior, this is the scrotum. This is the scrotum, and this is the penis. Okay, this is the pubic symphysis. Okay, superior ramus of pubis. This is the conjoint ischiopubic ramus. Obturator foramina is here. So this is the posterior scrotal nerve. Posterior scrotal nerve. And then this branch, which will still further go up, okay, anteriorly, this will be called as the muscular branches of perineal nerve. So this will give muscular branches to the perineal nerve. So there is one first branch, inferior rectal, from the internal pudendal nerve, and then pudendal nerve divides into two branches. One is called as the dorsal nerve of penis, and another is called as the perineal nerve. And perineal nerve here further is dividing into a muscular branch and a sensory branch, which is called as posterior scrotal nerve. Let us see the distribution of these branches. Okay, so we are on the branches of the pudendal nerve. So the first branch was inferior rectal nerve. See, this was this inferior rectal nerve here. Okay, it will go towards the anal canal. This inferior rectal nerve will supply the to the external anal sphincter, the motor fibers to the external, the three division of external anal sphincter. It is subcutaneous, superficial, and deep division. The voluntary muscle will be supplied by this inferior rectal nerve. So this is major source of the supply to the external anal sphincter. Okay, then this will also give the branch to the levator ani, which forms the pelvic diaphragm. Okay, the levator ani muscle. Then this nerve will also send a branch to the anal canal, that is to the mucous membrane of anal canal below the pectinate line. Thus, the area of the anal canal below the pectinate line is sensitive because it is a somatic nerve. Then this inferior rectal nerve will also send a branch to supply the skin surrounding to the anus, okay, on right side as well as on left side. So this is sensory to the skin of the perianal region, okay, to the peri. So this is an important nerve, inferior rectal nerve, branch of the pudendal nerve. Let us go to the perineal nerve. So this will divide into two further, the terminal branch of the pudendal nerve. One is called as this perineal and another is called as the dorsal nerve of penis or clitoris in case of female. So let us see perineal nerve. Now this perineal nerve will run into the Alcock's canal or the pudendal canal further and will give a cutaneous branch which is called as the posterior scrotal nerve, and this posterior scrotal nerve will supply the sensory fibers to the posterior 2/3 of the scrotum, or in case of the female it will give the labial branches which will supply the posterior 2/3 part of the labia majora and minora. Okay, so this in both the sexes it will supply the posterior part of the either labia majora minora or the scrotum. Okay, scrotum. Okay. Now this nerve is also giving a branch to the muscles of perineum. Okay, the muscles of perineum means or urogenital diaphragm. This will in relation urogenital diaphragm, this will give the muscle which is most important muscle supplied by this muscular branch of the perineal nerve is the sphincter urethrae, which form the urogenital diaphragm itself. So it will supply to the muscular this sphincter urethrae muscle. Then it will supply to the superficial perineal pouch muscles like superficial transverse perineae, ischiocavernosus or ischiospongiosus muscle, okay, and also to the deep transverse perineae. So these are the muscles of the superficial and deep perineal pouch, including the sphincter urethrae, which are supplied by the perineal nerve, okay, which is a branch of the pudendal nerve. Right. Then the third branch which continues as the dorsal nerve of penis. See here, this is going here. This is the dorsal nerve of penis, and this dorsal nerve of penis, and in case of female, it is called as the dorsal nerve of clitoris, and it runs into from the anteriormost part of the pudendal canal, and then it will run deep to the deep perineal pouch, okay, very close to the conjoint ischiopubic ramus, okay, bone, and then it will go just below the pubic arch, okay, just below the pubic arch where there is a gap between perineal membrane and the inferior surface of the pubic symphysis. Through this gap it will come out, and then it will go onto the dorsal surface of the penis just beneath the skin, okay, just beneath the skin, and then it will supply sensory fibers to penis, that is not only to the body of the penis but also to the glans penis, okay, skin of the body and the glans penis. And in case of female, this will supply to the clitoris. So these are the branches of the internal pudendal, I'm saying not internal, a pudendal nerve, okay, and I have drawn these nerves here in this diagram with the help of the black pencil, okay. So just note down all these branches of the pudendal nerve. Now I said at the beginning that this pudendal nerve is an important nerve clinically, and this is the nerve which supplies to the lower perineum, okay, and hence this nerve is has to be anesthetized when a surgeon is doing some surgery in the either in the posterior half of the scrotum or posterior two-thirds of the scrotum or around the anal opening. Okay, say for example in the piles, okay, or fistula, or just I mean to say abscess, okay, around the anal canal. A small abscess can be drained. So this nerve has to be anesthetized. Which nerve? The pudendal nerve. And this anesthesia which is done is called as pudendal nerve block. That means if you will put the anesthetic agent, okay, around the pudendal nerve, this will anesthetize the area supplied by the pudendal nerve for some time. Okay, so this nerve is infiltrated with the local anesthetic. Local anesthetic means you just put some amount of, I mean say quantity, that is about 2 to 5 cc of the anesthetic agent around the perineum, this pudendal nerve, which will anesthetize is for some time. So this is done, okay, this pudendal nerve block is done where it crosses the ischial spine. See here, this was the pudendal nerve. See here, this nerve, it is coming and lying posterior to the ischial spine, and then it is entering inside the lesser sciatic foramina. So this is the site where one can put the or inject the anesthetic agent. Just pour the anesthetic agent in this area of the ischial spine, and for that one need to feel first the ischial spine. And how can you feel the ischial spine? Just by putting the finger in the vagina in case of female, and then feeling it, and then guiding this I mean to say this ischial spine with the help of the finger. That needle is inserted through the vagina where the finger is guiding the needle, okay, and just inject the anesthetic agent here around the ischial spine, and then this anesthetic agent will go into the Alcock's canal, okay, it will go into the Alcock's canal and will anesthetize the pudendal nerve, okay, it is into the pudendal nerve. Now this is done in the lithotomy position, okay, and thus with the gravity also this anesthetic agent will go, okay, towards the trunk of the pudendal nerve, okay, and will anesthetize it, okay. Now either you can put this I mean to say anesthetic agent through the vagina, or it can also be through the skin of the perineum, okay, just close to the where your finger is still inside the vagina or inside the rectum, just feeling the ischial spine, and it is guiding the needle through the skin, okay, needle through the skin. So this is called as pudendal nerve block, okay, pudendal nerve block, okay. This complete a short note on to the pudendal nerve. Thank you very much for watching this video.